Well, good afternoon and welcome everyone. I'm Beth Stewart, Director of the Texas Oral Health Coalition, and on behalf of the coalition and our conference partners, the Texas Health Institute and the Texas Department of State Health Services Oral Health Improvement Program, I'd like to thank you for joining us for the third session of the 2020 Texas Oral Health Virtual Conference. So our second presentation today is developing an effective health communication campaign, lessons learned from the community water fluoridation campaign. I would like to now introduce my colleagues and partners in the Texas fluoridation campaign. First is Dr. Mike Mackert. Mike is the director for the University of Texas Center for Health Communication. He received his master's in Information and Telecommunication Management in 2003 from the Michigan State University in East Lansing, Michigan. He received his PhD in Mass Media and Information Studies in 2006 from Michigan State University as well. Our second presenter is Dr. Josefine Wolfe. Dr. Wolfe is the director of the Oral Health Program at Texas Health Institute. She has over a decade of oral health leadership experience and is a national dental health educator and speaker. Dr. Wolfe is a registered dental hygienist, certified health education specialist, and National Health Service Corps Scholar alumni. She earned an undergraduate degree in dental hygiene from the University of Texas Health Science Center at San Antonio, a Master of Science and a PhD in Public Health from Walden University. Dr. Wolfe holds an adjunct faculty position at A.T. Still University in the College of Graduate Health Studies and serves as chairperson for the American Public Health Association's Oral Health Section. Dr. Wolfe is also a member of the Speakers Bureau for the American Association of Public Health Dentistry. So let's begin with our first presenter, Dr. Mike Mackert.
Hi, my name is Mike Mackert. I'm the director of the UT Austin Center for Health Communication, and I'm excited to be here sharing with you all today at the conference. I love these kinds of events. It's a chance to take the work that we do in health communication and share with folks who are focused on a particular public health issue. And so I'm excited to be here today and sharing some of the work we've been doing on this community water fluoridation campaign we've been working on for about 1.5 years now. So this is exciting. We haven't gotten a chance to talk about this one in public as much, so it's cool to have the opportunity to share with you all today. So what I want to do today is a couple things. First, just as context, I want to talk about sort of defining health communication and the work our center does in general as a little bit of context, and then offer a couple tools that we use in our work that I expect some of you might be able to make use of. One of my goals in a talk like this is always to give at least a couple tools or techniques that folks could take back into their own work right away, and then speak specifically about the Texas fluoridation campaign that we've been working on to just show a little bit of what some of those tools and techniques look like in practice as we pursue our work. So when I talk about health communication, I'm focusing on both the science and the art of using communication to advance the health and well-being of people and populations. And the two parts of that I always pull out, the first is the science piece. A lot of times we work with colleagues in public health and medicine and nursing. And a lot of times people think of communication as a soft skill. You know, maybe you learned it from a mentor, maybe you're just naturally a good communicator, but it's more than that. There's a real science and evidence base to communication. I have a colleague who studies how do you break bad news to people. Like there's a best way to do it. She can train you in it. You can get better at it. And so as soon, like we focus a lot on evidence-based health communication and really relying on sort of the theory and science of health communication to help support people's health and health decisions. And the second piece is this people to populations. If you think about any level at which communication can happen, interpersonal, within families, within organizations, mass media, social media, there are folks in our center who do health communication work in those areas. We are the only academic center in the country, as far as we know, that is jointly shared between a college of communication and a medical school. And so we're in a really unique position to advance our work. When we think about evidence-based health communication, we think about it in 3 big areas, and one is research. And so we have faculty and grad students and others who are doing research to build out that evidence base of health communication. We do education. So we have a minor for undergraduates at UT Austin, and we have a portfolio for graduate students. And we do different kinds of professional development events to sort of train people in how to apply that evidence base in their careers, whatever it might be. And then our center team also practices health communication. We do a number of funded projects, including one of the ones I'll share with you today, but working with organizations like Texas DSHS and HSC, MD Anderson Cancer Center, UT System, to take what we know about health communication and actually practice it and put it out into the world and implement health communication campaigns. And so those three opportunities that really kind of build on each other and take advantage of kind of those being three parallel streams of work really lets us kind of do the work that we like to do. So when we think about designing effective health messages, one of the important things to understand, it really comes from my own history a little bit. So I was in graduate school, I studied telemedicine. And the first project I ever worked on was a hospice system that was designed to work on very old video phones. And I fell in love immediately. It was a chance to do research and work that was really helping improve quality end-of-life care in ways that were really meaningful. And so when I landed here at UT Austin in the School of Advertising, it's a really unexpected career turn for me in a lot of ways. A lot of my personal research focus was on health literacy and how do people find health information and understand it and use it and communicate about it. And so when I landed in a school of advertising, the first thing I started to do was dig into drug ads, actually. And there's a lot of things about drug ads, potential positives, potential concerns. I'm not here to debate that. But one of the common concerns about direct consumer prescription drug ads is that they use an emotional appeal to sort of encourage a patient to go ask for a particular prescription drug from their healthcare provider. And that can lead to some challenging conversations, to be sure. But if you think about that a little bit differently, what that really means is a 30-second TV ad, a print ad, a billboard, wherever you might see something like this. It created such engagement with someone, they went and talked to their healthcare provider about it. And that's really great. And if you put that in a slightly different context, something like the Truth Initiative, no one has ever complained about the fact that the Truth Initiative uses emotional appeals to make sure that young people don't start smoking. And so a lot of the way I have thought about my work living in a school of advertising is what are some of the techniques and approaches and evidence behind effective advertising? And how do we turn that in service of public health and pro-health messaging? So the process by which I teach my advertising students to sell dish soap is this 4-step process. And I use it in my health communication campaign classes, and we use this in the work that our center does. The first step is research, which is what you think. If you're trying to solve a new problem, you're going to go read literature and government reports, and you might do your own interviews and focus groups. And there's a lot of ways you can pursue research. But the end result of that is usually just a lot of information and data. And it can be really hard to build an effective message and communication effort just on a big pile of data and information. And so the second step we talk about is insight. And what are 3, 4, 5 really important insights into the target audience you're trying to reach, where communication can make a difference and help change the way they understand a health issue, the decisions they're going to make, the way they're balancing the benefits versus concerns about a particular health behavior or policy. And once you get those 3 or 4 or 5 sort of really important insights, then you can start thinking about your big picture strategy. Who are you trying to talk to, and what are you trying to say to them? From there, then you start thinking about tactics. What does it look like on social media? What does it look like in a TV ad? What does it look like in a patient education brochure? Whatever tactics make sense to get to people. And there's a tendency often in lots of communication campaigns to jump right to tactics without really first having thought through that research, those insights, and that big picture strategy. And the tactics are a lot easier and easier to do well if you've done those first 3 steps. And so we really focus on that a lot in our work. Something that comes, I think, from folks who do work in public health is you're drawn to the work because you want to help people lead healthier lives. And you spend a lot of time thinking about oral health or even a particular area of oral health. And what that also means, though, is that you're probably not thinking about it exactly like an average person might. Like, you're too deeply invested in it. It can be hard to take this away. And so one of the things that coming to every health issue we work on is different often, is how can you think about framing your problem maybe in a way that communication can really make a difference, maybe not the way you would think of as a person who's in it coming from the public health side. So as an example, there's a lot of campaigns about taking the stairs. And usually those kind of campaigns, like get out of the elevator, take the stairs, are very much focused on the health benefits of taking the stairs. And sometimes those materials are really good. Sometimes they don't look all that great. But it's really based on this idea of it's the healthier decision to take the stairs. I think a lot of people know that it would be the healthier thing to do to take the stairs and not be in an elevator, but people still take the elevator a lot. And we ran a project where we thought about like, what are other reasons people would take the stairs? And how could we frame this in a way where communication can really make a difference and not just keep telling people again and again and again, it's the healthier thing to do to take the stairs. And so we started thinking about other benefits of taking the stairs or other maybe concerns about using an elevator. And this project was from a few years ago now, but it was like you control the stops on the stairs. So rather than just sit there for a couple minutes waiting for an elevator, you can just get right in the stairs and get moving. Don't pack yourself, take the stairs. This was done back when the primary concern would have been, where we thought about it is, just don't be stuck in an elevator with people yelling on their cell phones in a hot, sweaty Texas summer, honestly. And I think now, given COVID-19, I think, not packing yourself in the elevator has a really different meaning that we didn't intend at the time, but I think has a lot of utility right now. We tested these. The ads on the right work better to get people to take the stairs. And it also helps if you put them further away from the stairs when people are walking towards the elevator, when they're still making the decision if they are going to take the stairs or not. Like once people have stopped in front of the elevator, it's a little bit harder to get them to move. Another tool that we use in a lot of our work are personas. This can feel a little corny at first, honestly. I think my students always think I'm lying that this is how ad agencies do this work, but it really is, and it helps a lot. And so in all my advertising classes, I will have my students do a project with the on-campus health promotion office, and they're great to work with. I let them pick the health issue, and one semester they picked skin safety. And so my students spend 4 or 5 weeks, digging into their research and trying to build their target audience. And one of the first teams, and then, the client shows up and the students are all going to take turns presenting. And one of the teams shared this as their target audience. And they said it's members of sororities on the UT Austin campus who are 18 to 22 years old who use tanning beds. This is a correct answer to the question of who would be a good target audience for this skin safety campaign project they were working on. Like, they're right. And then they had a reasonably good answer to the question. But then the next team got up and they used the persona that I teach as a technique for them. And they said our target audience is Rachel. And she's a member of Chi Omega. She shops at Nordstrom. She drinks Starbucks. If you look at those Health Queen and Believes little blocks of content there, you can see, she goes to a dermatologist. She is aware of the risks of UV tanning. She thinks tanning makes her look thinner and have a better complexion. Rachel knows it's not the right health decision to use a tanning bed. She does it anyway. Telling her again, it's not the correct health decision is not going to help her change her mind. So when you think about building a good message, having this one representative persona can really help a lot to build more effective messages. And so if you build a message that's going to work on Rachel, maybe based on shorter term concerns, maybe based on things related to health or appearance that are in the short term matter more than increased risk of skin cancer far in the future, that message will probably work on a lot of people who are a lot like Rachel. And so this is a really helpful tool to think about what's going to be persuasive in a way that's harder when you just have this more demographic statement of your target audience. Last tool I want to give you is this idea of a single most important thing. I will often challenge my advertising students to get the message of a campaign down to a single sentence if they can. And I'll, if you're, say our campaign is going to achieve, and then there's 14 bullet points, I'm going to tell you don't know what you're trying to say yet. And so if you guys remember the Verizon "Can You Hear Me Now" ads way back in the day, I had the chance to meet with the creative team that built that campaign. And they said it was actually a single word that they used to guide that effort. And if you think about it for a second about what that word might have been, usually people start thinking about reliability, speed. Like you start describing what a good cell phone network might look like. And the actual word they used was relentless. And the way they talked about that was that it's not that their network is faster, more reliable, better connections, all those things than Sprint and AT&T. They wanted to communicate, we are working harder than AT&T and Sprint to make our network the fastest the most reliable. It's a really subtle difference, but it's an attitudinal thing. And that was what that guy was meant to communicate when he was walking around with his cell phone, just saying, can you hear me now? Can you hear me now? Can you hear me now? Is we're working harder. And if they produced a TV ad and it didn't communicate relentless enough, they'd redo it. And that was a nice, helpful way of them maintaining focus as they went. So what I want to do now is just show you a little bit of what this looks like in the development of a health communication campaign, specifically our Texas fluoridation campaign that we've been working on. And this has been really neat. I never had a chance to work on community water fluoridation as a health issue. One of the things I like most about the work our center does is we get to sort of float between different public health issues and different populations. And often what we learn in one helps us with another, which is a great benefit of the way we get to do our work. But I just get to learn a lot. And I'll make clear right here that I'm not the public health or the content expert for anything that we do. We rely on colleagues in public health and medicine and nursing and social work and pharmacy and all those sort of the health experts to tell us that part of it. I come at it very much more from the communication side. And so when we started digging into this community water fluoridation campaign, this is fresh to us. So we dug in and started to understand a little bit of why community water fluoridation might matter, understanding the way community water fluoridation rates across the state have been dropping, and thinking about who should we be targeting and why. And before we even did research yet, we started to think about the idea of Texas parents as a target audience, and maybe particularly really engaged PTA parents. Because community water fluoridation happens, like I cannot as a single person decide that I want my water fluoridated. It requires advocacy and promoting systems of change and doing things that kind of an individual human can't do. Then trying to target people who already do that, maybe in other contexts, around their kids' schools, for example, is a way to take someone who already has some of the skills you might need to do this, and then give them a new issue to care about. And so we had this persona, and there's more to her than this, but we called our persona Andrea, and said she's a 37-year-old mother of two, civically engaged and health conscious. And those were really key things we were going to think about. How could we reach this person like Andrea, and then lots of parents who are a lot like Andrea, and help them become either advocates for community water fluoridation, or at the very least understand why it's important, so they have more knowledge than they might right now. And so we decided to do a couple surveys of Texan parents. We recruited parents in that kind of demographic with kids of the right age, and did a survey in fall 19 that had 312 Texan parents around the state. And one of the insights we got and things we learned was 49% had not thought about fluoridated water before taking our survey. So this is not an issue that's top of mind. 48% didn't know if their water was fluoridated. And people were pretty neutral on a lot of this. Like, I think you can see here, I personally believe water fluoridation benefits the community was basically the midpoint on a 5-point scale. I worry about potential health risks of fluoridated water, kind of the midpoint on a 5-point scale. And one of the things that we also were intrigued by was this idea of, there was sort of this more general fear of fluoride, like maybe it's a thing I should be worried about, but I don't know why exactly. In the way that I think more people who are vaccine hesitant could articulate, well, I've heard vaccines cause autism. And so it's a more general kind of concern that isn't rooted in specific knowledge, again, because half our folks had never thought about community, water fluoridation before taking our survey. And you can all see here how many of the families we surveyed drink bottled water as their main source, and only a quarter relied mainly on tap water. So that helped us start to think a little bit more about what key messages might be, what might this look like. And so we, worked on this creative brief. And so we wanted to sort of really work on creating proactive public support for community water fluoridation in Texas, and help folks understand that drinking fluoridated water is an important part of oral health. So you can see here our Texan parents with kids who are ages kind of 4 to 12, really felt like the age range we were looking for. We want people to maybe go to a website to learn more, maybe share messages on the issue to help spread information among other engaged parents. Really clear, we didn't want to do scare tactics, and instead wanted to focus on protective benefits of drinking water, rather than directly combat anti-fluoridation messages. We know from lots of work we do, you have to be thoughtful about where communication can make a difference. And if someone already doesn't think fluoridation is a good idea, I don't think you're very likely to sort of communicate to them and change their mind. And in a situation like this, where so many people have never thought about it before, it's likely more effective to proactively try and build some awareness and education in that population. And so we made it the way we thought it was like, this is not an anti-fluoridation campaign. And so we really want to focus on general oral health and community oral health, because that seemed to be more effective in our survey. And also then it's not just a campaign just about water fluoridation, which again isn't a top of mind concern for most folks, but trying to build it into broader oral health promotion, which probably more people are thinking about. So we started work on building messages. One thing we do a lot is, we build lots of different concepts and ideas which we can test. Again, going back to that evidence-based idea, we have to be willing to be proven wrong and follow our data where it might lead. So we built 5 different campaign ideas with some different ideas kind of driving each based on that research. And so the idea, in one case of, water fluoridation matters across a lifespan. And so it matters for your whole life. It's like a general idea here. We were trying to think of ways to use stories to get people interested in the topic and willing to share, and also highlight that maybe community water fluoridation is a way to have some oral health promotion and protection, even when your kid doesn't brush their teeth all that great sometimes. And this was meant to be, always with the idea of what might be shareable on social media. If we imagine one of our goals is that Andrea might share this within her networks if she sees the messages. We really wanted to promote the idea of, community water fluoridation, and it benefits everyone. And so this idea of how do you show that it benefits an entire community isn't about just like one individual or one individual household. Had an idea about trying to promote water basically as a consumer product, and what are some of the benefits that we could offer. Talk about using tap water over bottled water, so things like good for the planet. Last one was, there's a lot of work around how do you create more engaging visuals. And so this 5th idea here was really about trying to use the little, you can see it in we call it this our chipped tooth idea. And you can see in the picture of the person in the ad there, like her tooth has sort of like a bottle of like a glass of water removed, and trying to just get a visual metaphor idea that would get people to engage. So this is a visual engagement approach we wanted to test. So we pre-tested these with 200 Texans. And we showed each concept both with and without a logo to test how much source credibility might might matter for people to believe the message or not reject the message, which are a little bit different, or be willing to share or take action, those kinds of things. You can see here some of the things that we were measuring, like attitude toward the ad, likelihood of sharing, information processing, source credibility. And I'm going to put all of our messages up here again. And I'm going to give you a minute to think about which one you think might have won. And we tested these again with 200 Texan parents. And we went in to look at our data. We're always hoping for just a clear top choice. And what we really found at first in our data was just that the chip tooth idea was definitely not the winner. The other 4 all had things going for them, all had things that were potential concerns that weren't as strong as some of the others. So it was this idea of, 4 concepts that all kind of worked equally in the data in different ways. And then we had to think a lot about what that meant. And so we started to look at these 4 and think about, a lot of times, we maybe have 2 that come to the top. And then how do you take the best elements of 2 and combine them in some way to make them work a little bit better? And so we ended up thinking, the 2 we really wanted to focus on was the 2 that are on the left here. The lifespan idea, because it helps talk about why it matters no matter how old you are, and it benefits an entire family. That particular visual style would also make it much easier to represent diversity around the state. Texas is an increasingly diverse state, and it's an easy thing to do some work with that visual style to show all kinds of Texans. And then the one on the left there, my kid went to camp for 5 days, their toothbrush did not, was the other one, because it was this engaging, fun, different way of telling the story of oral health and community water fluoridation that we felt had more potential for shareability. And so you can see here some pros and cons of each. Thinking about what do we like about the top one and what do we like about the bottom one there. And then the next step in the process, which we're in the middle of right now, is how do you take these 2 ideas that both have things going for them and start to combine them in meaningful ways to take advantage of the strengths of both. And so as an example, one of the things that we're working on is taking the top, like the visual style of the top one, and maybe only showing one of the circles of a kid. And then you start talking about this idea from the bottom, like my kid went to camp for 5 days, their toothbrush did not. And so we can kind of take the best of both worlds and start combining them, and a little bit more testing and checking to see how that's going to work before you could then really build out a whole effort. One of the reasons I always feel confident and comfortable sharing some of these ideas and the approach we take is that we do this across health issues no matter what we're working on. We've done projects on hand hygiene, both on campus and in a hospital setting. We do work on this Father's Playbook app that's meant to increase expectant dads' engagement in prenatal health, opioids with the state of Texas, tobacco control for UT system. And no matter what we're working on, we follow these same steps and principles. And so, there's a lot, I think, that we've learned, and it helps that we get to go between contexts. But if there's one thing that I guess I would invite you to think about and take away, is this idea of sort of audience-driven communication and policy design. Like if you can think and work to think hard about the way your target audience is going to hear a message, it really helps you communicate with them more effectively, especially when there's this gap in the passion and dedication from people who do public health as a calling and a living and a profession, and sort of normal people who don't think about public health that much, any particular health issue that much. And if you can better put yourself in the shoes of the people hearing you, it can help you then rethink what kind of messages are going to reach them in ways that will support their health and the decisions they want to make, and help you achieve the public health aims you might be aiming for. So again, I want to say thanks for both the invitation to be here as part of this event. I really always enjoy the opportunity to share the work that we do in general, and specifically in this case, work that is really directly related, obviously, to the topic of the conference. And so if anyone has any questions for me, I could talk about health communication all day. I was aiming for 25 minutes and I'm pretty sure I hit that. But I really invite folks to reach out to me by email. You can find me on Twitter. You can find our center online. And we just really welcome any questions or thoughts you might have. You can reach out to me all those ways. And just thanks again for the opportunity. This project is one of the really fun ones we get to work on for the last year and a half. And we're excited for the next few months of work to really get it finished up and ready to share with the world. So thanks very much. Appreciate your time. Thank you.
But now I give you Dr. Josefine Wolfe.
Thank you, Beth. And that was a very good presentation by Dr. Mackert. What I'm going to be presenting on in the second half of this presentation is just a little bit of a deeper dive into the research and specifically some of the oral health information that we gathered. I want to begin by acknowledging that this is a joint project by the Texas Health Institute, of course, the Center for Health Communication, and by the Texas Oral Health Coalition. We want to acknowledge our sponsor. This project is funded by the Delta Dental Foundation. And let me just start off briefly by reviewing some of the main campaign missions and goals. When we started this campaign, we started really with the intent to get a better understanding of some of the fluoride hesitant sentiments in Texas, and to develop some really good data-driven messages aimed at communicating the benefits of community water fluoridation, but more importantly, really to begin to disseminate the messages towards targeted populations. So ultimately, we theorized that by understanding how fluoride hesitant beliefs are constructed, then we would have a better chance of deconstructing them. And as Dr. Mackert mentioned, we used all of the tools in our toolbox. We looked at both qualitative and quantitative data when we began this project. And some of the things that he mentioned were some of the surveys that we did. Essentially, we could pocket these into 3 different surveys, beginning with kind of this audience view, and then he talked about the messaging survey and then the concept survey. So I'm just going to pull out a couple of key details in this project. I want to begin by acknowledging that the Center for Health Communication was very instrumental in sort of helping us to go down this path of developing our communication messages. But really, without subject matter experts, this project would not have been possible. And some of those subject matter experts were, for example, Beth Stewart, who is with the Texas Oral Health Coalition, who has a wealth of experience working around the issues of community water fluoridation, in particular, the data that's available for community water fluoridation and tracking across the state of Texas, the trends. So we really tapped into that knowledge at the very beginning. And one of the first things that we did was really to get a good kind of overall environmental kind of scan of the situation. And we did that through 3 different ways, as we mentioned before, qualitative and quantitative data. But we also looked at existing health messages and what was existing in the social media platforms. And so I'm just going to talk briefly about some of those things. One of the ways that we looked at what was existing in social media platforms is we used something called a Nuvi software. So this software kind of went out and it collected all of these key terms, and it gave us this set of data, aggregated data that we could then look at to see kind of what people were saying about communication, about community water fluoridation, and just fluoride in general. One of the other things that we did is we did a quantitative study where we looked at what water operators were thinking about community water fluoridation. And this was one of the very first surveys that was sent out. And what we actually found is that the majority of community water fluoridate operators, they were getting their information about community water fluoridation from federal and state regulatory organizations, professional organizations, public health experts. It's sort of narrowed down to where down here, social media, that was actually 1%. So the majority of them were getting their information from federal and state regulatory organizations. So that was good information to know from the very beginning. We also did some key informant interviews with dental and dental hygiene schools, and to really get a sense around what was being taught in the curriculum. And kind of as a summary, what we found is that most of the faculty felt it was important for the students to understand the history around community water fluoridation. In most cases, students were taught how to address fluoride hesitant sentiments, but what we also found is that they were not really instructed on how to communicate about community water fluoridation as a preventive measure, or kind of what we consider that anticipatory guidance. And when we asked them how we could help in that sense, one of the things that was most requested was a communication toolkit, essentially to help students communicate about community water fluoridation, simulations, or specific dialogues that students could incorporate into their clinical practice. So those were some of the research initially that we did from the very beginning. And then following the pathway that Dr. Mackert pointed out, the next thing was really to gather some insight. And as he mentioned, we really wanted to get a good understanding of the current landscape and get some more insight. So we developed early on a logic model with audience. So as he talked about Texas parents, but we also thought about oral health policy advocates, and also the dental and medical professionals. Ultimately, the outcome that we were looking for, though, was to increase the use of community water fluoridation, and also to have this proactive support for community water fluoridation. And just briefly to review some of the things that we found in this study that were particularly helpful as the oral health experts looking at creating these communication messages. What we found was that most people, 48%, actually didn't know if their water was fluoridated. More importantly, 18% knew specifically that their water was not fluoridated. And as was mentioned, most people had not thought about water fluoridation before today, but interestingly enough, 45% had come across information about fluoridated water, either in the media or online. So there was some interaction there with information. But when we looked at specific behaviors, we found that when they were asked what type of fluoride or what type of products are used in the home, 81% of them said that they use some type of fluoride toothpaste. Mouthwash was a little less, and then topical fluoride from the dentist was a little less, but only 7% said that they did not use any type of fluoride at all. And then we looked at the source of water. Where are folks getting their water from? 44% were getting it from bottled water. 24% were getting it from the faucet, 18% other filtered water, which we kind of assume is probably refrigerator type filtered water or some other type of filter system. And then 14%, which is the pitcher-based kind of filtration system. But this is really interesting. When we talked about how do they feel about fluoridated water, so what are their sentiments, their kind of feeling, what we found was that the majority, and they could pick more than one, were curious, optimistic, and hopeful. A very few percent were actually anxious, fearful, and angry. We'll circle back to that here in a second, but this particular question about how do you feel about water fluoridation. So I also wanted to mention quickly some of the other belief statements that we asked. Now, remember when we're measuring from 1 to 5, your neutral is a 3. So neutral would be a 3.0 on a scale of 1 to 5. We were very pleased to see that most individuals recognize that oral health is an important part of overall health. So that was already well acknowledged in our population that we surveyed. It was also evident that our population trusted dental professionals, but also almost equally trusted medical professionals. So we see there a 3.79 and a 3.71. So those scored very high in our survey. And we actually used this information later on as we were developing some of those concepts. Another thing that we thought was very important is who do you trust to receive information about oral health and water fluoridation? This was important because it helped us to understand who we should be targeting to help us disseminate our toolkit. So the previous slide showed us that individuals trust their medical professionals, and the same thing was verified here. So individuals trust their dentist and their dental hygienist, but equally almost, but very high ranking were the medical professionals, the public health associations, nurses and doctors, really reinforcing that interprofessional collaboration for preventive oral health practices in our community, and getting the medical and dental and other professions involved. So in general, just as a summary, what we found was that those messages that promoted a general oral health and general community health, this kind of health equity for all, really scored better, as opposed to community water fluoridation will help me do better, will help me make more money, will help me be smarter. It was really this sense of it's better for the community. Also, that participants really trusted advice from their dental and medical professionals. And more importantly, that although participants really had not thought too much about community water fluoridation, they were curious and optimistic. So using some of these key factors, we moved on to that next stage, thinking about what do we want them to think? Okay, this is what they think now, but really the purpose of this communication project is to kind of change their thinking in a sense. So really what we wanted is we wanted that drinking community water or drinking fluoridated water was just a part of the natural health culture for a family. It would be a simple and automatic health behavior, positive health behavior, just like going for your regular dental checkup or making sure the batteries in your smoke detector were up to date, things like this. We also wanted to prepare individuals to proactively support community water fluoridation should the discussion come up, either in social media with another parent or in the community as an issue to be voted on. And so that kind of took us over to that next step that he talked about, is kind of that strategy stage. The case study that we always were encouraged to keep in the back of our mind was really remembering the purpose of the message and what the key message would be. We also always remembered the audience, which was Texas parents and this persona of Andrea. So as we were beginning to develop the campaign and beginning to bring some of those ideas in, we always came back to this case study that was developed. And that really helped us to narrow our frame. Some of the, and I'm gonna go back at the kind of the end of the presentation again and just revisit this case study, but I just wanted to quickly show everyone some of the concepts that were presented to us. And these are concepts that we see out in the community or out in publication now. General emotional appeal. So fluoride makes your mouth stronger. Fluoride, you see these two ladies down here. Fluoride is a mouth saver. It makes you a happier person. Also, visual metaphors were some of the concepts that were presented to us as well. We looked at several of those, kind of incorporating one visual metaphor into, or the theme into a visual metaphor. You can kind of see like this little pack of gum. It sort of looks like teeth, and you can't read that, but it says your breath is horrendous. And same thing with this little milk bottle down here. General oral health tips were another thing that we were presented with. And a lot of times as researchers and scientists and statisticians, we love our numbers, but we, from the data, we saw early on that our population really already understood the importance of oral health to overall health. But this was one of the concepts that was also presented to us and that we reviewed. Kind of that other concept was that general health perception that we talked about a second ago. These are the concepts that encourage individuals to participate in a behavior automatically and kind of without thinking. So those were the kind of concepts that we considered. Okay, so then we were back to this case study, and one of the things that Mike mentioned was that we did not use any type of scare tactics. Remember when we discussed the beliefs that individuals had, we were very careful not to incorporate any type of scare tactics into our campaign. We did not want to create any sort of what's called infodemics or cause a new problem to arise where maybe messages unintentionally cause any sorts of seeds of mistrust. We really wanted to have a positive campaign and a positive message, understanding that individuals, one, trust their dentist, are optimistic about community water fluoridation, and understand the importance of oral health to overall health. And one of the things that we did, which was really interesting, and others can do this as well, maybe with creating their own cards or getting a set of these cards, but we were asked to, we took a stack of cards. These are called brand deck. And we were asked, the brand deck has a specific word on each card. And we were asked to take these cards and separate them into, very quickly into two piles. What we wanted the campaign to represent and what we did not want the campaign to represent. And then from there, we had to narrow it down to 5 words. And then from there to, or from 10 words to 5 words. And then each group put in their 5 words, and then from there we narrowed it down. Now, remember when Mike said, if you have too many things that your campaign is trying to get across, you've not really decided yet what your campaign is trying to accomplish. And so this was a really helpful tool for us to help us really narrow down what we wanted our campaign to say, and really that kind of feel and theme that we wanted it to have. Now, up to this point, we really have just been doing a whole lot of research. We've not actually gotten into the creation of any messages yet. And as Mike showed you, we did start off with about 10 to 15. Then those were through some research narrowed down to about 5. And then, as he mentioned, those were narrowed down to the final 2. And some of the things that were looked at were attitude about the message, the likelihood of people sharing them, and different things. The next kind of step in this really relates to a lot of the information that we gathered early on, are the toolkits that will be created based on a lot of this information. These toolkits are still in progress, but please look at the Texas Oral Health Coalition's website here in the next couple of months. They should be updated there. We will have social media messages for both dental and medical providers to share across their platforms and within their networks. We are also going to have resources for dental educators to focus really on how to frame those community water health fluoridation messages, and also some amazing infographics on community water fluoridation, some data that's going to be there on the website. So I just kind of wanted to mention those things. Now, although this is the framework that we showed you, this is kind of that linear track that we went down, I wanted to point out that in fact, it really did not happen that way. It kind of happened more like this. There was a lot of things going on simultaneously that we would not have thought about as oral health experts because we were not the communication experts. I mean, there were things like color theory that came into the conversation, and sort of several different things that helped us along the way to develop this toolkit for educators. I wanted to close by really mentioning a couple of key takeaways for those of you that might be listening today that don't have access to this incredible resource like we had for our campaign. And some of those things that I would really stress in the beginning are get to know your audience. Really do the background work to understand who is your audience. Do not make assumptions. So you remember how in the very beginning, we looked at water operators. We knew very early on that creating any type of message, social media message for water operators would not be effective because the data told us that that's not really where they get their information from. We also really took the time to get to understand what our audience thought about this particular topic. So these are some things that you can do if you're developing a communication campaign. Also, to have a very specific purpose and message. What is that one important thing that you are trying to relay? We were always brought back to what is it that we're trying to do? What is it that we're trying to say? Trying to get across too many different messages or specific purposes of our campaign would have just confused things. So we were very, very specific in the message that we were trying to relay. Also, recognize your biases. Be prepared to let go of any preconceived ideas. One of the things that we asked in the survey, or one of the messages that we kind of tested was this message surrounding kids and school absences due to dental decay. Well, I would have thought that would have scored very well because of course everybody cares about kids with cavities missing school. But in fact, that was not one of the concepts that scored very well. So we might assume that individuals either do or do not trust their water, or do or do not trust a medical professional to deliver, a dental professional to deliver information, but really be prepared to do the research to get to know your audience and to let go of some of those preconceived ideas. Also, another very big kind of takeaway from this project is that we realized how much work really goes into developing a good communication campaign. And sometimes we want to develop our own communication, but maybe we don't have all of the information that we need. Maybe we don't have all of the research capacity that would help us to do those things. Sometimes, in fact, there are other organizations that have already created those messages. And so also looking at sharing other people's messages that have had some of the experts on their team, like we had, to develop messages. So of course, we encourage you to share messages from the Texas Oral Health Coalition, but also to look at your other national leaders and state leaders surrounding your topic areas, and really share those messages that come from those areas as well. This is my contact information. I'm happy to take any questions either offline, or I will stop sharing my screen now and let Beth take over. But if there's time for questions, she will let us know.
Yes, thank you, Josephine. Dr. Wolfe, that was really a good presentation, and we appreciate you providing this information for us. One of the things you touched on that surprised me in all of this research was, again, about what they responded to. I was surprised they weren't really affected by how much it cost, or how safe is it, or how effective is. It was all about health. And so that was kind of the surprising turn with all the research that we found. We do have one question in the chat box for you. Why is it bad for kids to swallow fluoride toothpaste, but okay for kids to drink fluoridated water?
I'm sorry, ask me the question again.
Okay. Why is it bad for kids to swallow fluoride toothpaste, but it's okay for kids to drink fluoridated water?
So the recommendations for fluoride toothpaste are a smear for very, very, very young children, and a pea size for children. I think it's like 3 to 5 years of age. Don't quote me on that, but some of that information is on the Texas Oral Health Coalition's website. So when you're using the proper amount of toothpaste, it's fine if the child were to swallow it. If you're using that small amount that's recommended, it's not harmful to them at all. That is kind of the answer to that question. And of course, it's always best for children and adults throughout the lifespan to drink fluoridated water, and to also use an appropriate amount of fluoridated toothpaste daily.
And that's true. Thank you. I will expand, if you don't mind,
Yes.
on your response. There has been in the past, people felt that by swallowing the fluoride toothpaste kind of led to an increase in fluorosis, which is an intrinsic stain from too much fluoride. And the other thing is, if you've ever swallowed toothpaste when you're brushing your teeth, you know how it kind of nauseates you and makes you sick to your stomach. So if you do swallow too much toothpaste, you will throw up. If you just feel nauseous and want to throw up, you can always drink a little milk and it'll make you throw up. But that's one of the reasons why you don't want to swallow toothpaste. That, and it's so concentrated. The concentration, the fluoride level is higher in toothpaste than in community fluoridated water, because when you drink the tap water from community water fluoridation, it's at the perfect level. It is where you receive the optimal level for health, the health benefits, but it does not have the risk or bad effects from it. So community water fluoridation is that way to get extra protection against dental cavities. So we do recommend drinking water, community fluoridated water, and also brushing with fluoridated toothpaste, just to get that 1-2 punch, like car seats, the airbags in cars and seat belts. We used to have seat belts and then they added airbags. But when we added airbags, they didn't discontinue seat belts. They said, oh no, you need that as well. So this is both. You need both as well for that optimal protection. And I see we have one more question in here. Let's see. Does bottled water have fluoride in it?
That's actually a really good question.
Yeah.
Some bottled water does have fluoride in it because it comes straight from the municipal source. So it's actually tap water that's put in a bottle. But each one is unique, and there are literally hundreds of different types of bottled water. So you would just need to look at the label individually.
Right, and if they add fluoride to that bottled water, it will say that they've added fluoride. They do have to put that on the label. But again, most bottled water doesn't have additional fluoride in it. But again, they could be filling it up from the New York tap water, city water, you never know. Are there any other questions? And let's see. Okay, I see a comment, very essential information from both speakers. Thank you. So again, thank you, Dr. Wolfe. Thank you, Dr. Mackert, for your presentations. Josephine, Dr. Wolfe had mentioned our data dashboard on our Texas Oral Health Conference Coalition, Texas Oral Health Coalition website. We have a data dashboard where you can see an entire data information about community water fluoridation, so you can get extra information there. Our many thanks again to our presenters and moderators, and thank you audience for joining us today. Have a pleasant afternoon, everyone, and we'll look forward to seeing you next week for our 4th session of the Texas Oral Health Conference.